the announcement? There it is. Okay.
And can you see my slides okay?
Yes, we can see them great.
Okay.
So good morning, folks, and welcome to the WellMed Charitable Foundation Caregiver Teleconnection Series. We're very fortunate this morning to have someone who's spoken to us many times on many different and wonderful topics that we need to hear as caregivers because they help us in our daily work. So we just want to recognize all of you caregivers who are on the phone. We're so happy you're with us. Please feel free to participate either by chat or, by um, talking to us at the end of the presentation during the question and answer period. So with that, I am so lucky to be able to introduce Hollie Lowe, who has many initials after her name. I don't know what they all are, or I would tell you. But she's an expert. How long have you worked at that place? Holly,
8 years. 8 years.
you're going to tell us a little about yourself, right?
Sure.
Okay, go on ahead and then present.
All right. So I am Holly Lowe. I'm the Director of Education and Family Support Services here at the James L. West Center for Dementia Care in Fort Worth, Texas. And what those letters are saying is that I've got a master's degree in counseling and that I'm a licensed counselor and a national certified counselor. I'm also a grief therapist and a certified death doula. So my job here at the West Center is to educate and support families as they go through their loved one's journey of dementia. Because we know if you're on this call that this isn't just going to be for a few days, weeks, or months. This is going to be for years. And we also know by studying and looking at research and the facts is that caregivers, over 60% of the time, whether they are spouses or adult children, we end up losing our caregivers because of the stress of being a full-time caregiver. So how do we then treat dementia and how do we take care of ourselves? We're doing it right now, education. So today we're going to talk about supporting independence and dignity and managing self-care in dementia. Some of the things that we're going to talk about, again, because we've got to have that background information, because the more we know, the more we understand, the better we are going to do. You will then find that your loved one is doing better. In fact, I've had families come up to me before and say, since I've been in support group, my loved one seems to be better. Well, the disease itself isn't better, is it? Because we know the disease isn't going to improve, but the way I'm responding rather than reacting is improving. And so, of course, they are better. We're going to talk about how to keep our loved ones safe at home. We want to stay at home as long as we possibly can. That is always the goal. And then some very specifics about some of those activities of daily living. But I want to jump in and give background information and talk about some things that you're going to take with you. And again, you will have copies of these slides, just like you'll have a copy of the recording of this to go back to over and over. Because if your loved one is not doing one of these things right now, you're probably going to see it throughout the course of the disease. And it's the 4 A's and the 5 senses. Dementia is brain failure. That's what's happening. They're going from that normal 3-pound brain all the way down to a 1-pound brain at the end of the disease. So if you think about that, their brain is failing. Well, what does the brain control? Everything. Everything. So they're losing their memory, they're losing their language, they're losing that impulse control, coping skills, their filter, their emotional control, how to take care of themselves, and their circadian clock rhythm. Because all of those things are controlled by the brain, and dementia is brain failure. It is so much more than memory loss. Memory loss is one of 36 common symptoms in dementia. Memory loss is one. So, what in the world happens with their activities of daily living? Showering, toileting, being able to groom themselves, to be able to feed themselves. Every one of those things that we just listed has a lot of steps in it. And sequencing is one of the things that goes away. What order do I do this in? Other things that are going to change but not go away are going to be all of the senses, and we're going to look at each of them. Now, language, that day-to-day language is on the left, and that left language leaves. That hippocampus is beginning to fail. But emotional language is on the right, and the right remains. That's where the amygdala is located. So emotional language stays, rhythmic language stays. And some of those emotional language, those forbidden words, curse words, sex talk, racial slurs, they're stored on the right because they're not day-to-day language. So we can hear from a person with dementia things that they never would have said, and it's usually during that ADL time, that activities of daily living time, because they're getting frustrated because they believe that they either can still do, or that we are trying to hurt them, or that we're trying to do something to them. We'll get more into that. I want to start with the 4A's. And again, if you haven't seen these, you will. These are going to happen regardless of what type of dementia your loved one has. Eventually, you'll see each of these 4A's. The first is amnesia, and amnesia is that memory loss. We've heard that word amnesia before, but there's different types of amnesia. There's different types of memory loss. For most of our loved ones, it's going to start with that short-term memory loss. It can be the immediate recall that they lose first. But there's different types of memory in there, because think about it. There's also, here's where those ADLs come in, activities of daily living, procedural memories. What order do I do things in? How do I do this? Yes, they've been brushing their teeth since they were little bitty, but now I see the stuff on the counter and I'm not real sure the order in which to do it. And I don't have the ability to tell you that. So I just don't do it. Or I try to do it and I end up with toothpaste all over my face. And then I'm shaving. Because I know I'm supposed to do something with it, but what? Because I'm losing procedural order. Episodic memories also. So if I don't remember how to do this, I can't do it. But sometimes they can remember, because dementia doesn't happen like that. It's over the course of a long period of time. That's why this is such a long-lasting disease. And so there's days that they will connect. Those dendrites are connecting, the synapses are connecting, and then there's a storm one night. You're in a bad mood. I don't want to eat. And it misses. I don't want to take my medicine. You're trying to poison me. And it misses. But the next night, I sleep all night. The sun is up. You're in a good mood. I'm in a good mood. I eat, I drink. I'm taking my medicine. Connect. There they are. And so it's hit and miss. Retrogenesis, I just want to briefly talk on retrogenesis. Keep this in mind with all dementias. They're going back in time. We're going back in developmental age. So when we were born, what were we doing for ourselves? We weren't feeding ourselves. We weren't walking. We weren't toileting. We weren't getting ourselves dressed. We could make our needs known. Even as a newborn, we could make our needs known. But I couldn't do it for myself. So keep that in mind. Aphasia, the inability to express or understand language. Now, in some dementias, it's worse than others. In some frontotemporal dementias, it starts with primary progressive aphasia, where they're having a very difficult time speaking, but there's another part to that, understanding. Make sure you hear that part. It's not just the speaking, it's the understanding. So we tend to talk slower and louder, thinking that's going to make them get it. And it doesn't. If they're not understanding, they're not understanding. Someone could stand in this room right now and be speaking Japanese to me really, really slow and really, really loud. I'm never going to understand it. It's the same thing. They're not understanding what we're saying. So we've got to find other ways to communicate. Now, this one's fascinating. I met with a gentleman this morning about this. It's called agnosia. And it's the inability to recognize objects, persons, sounds, shapes, or smells while the sense is not defective. Think of it this way. Here's the example. They hear the phone ringing, but they don't know where that sound's coming from, and the phone's sitting right in front of them. And how long have we been hearing phones ring? Here's one. They smell smoke, but they keep looking at the TV. We learned smoke means danger, and they're unlearning everything. It's going away. That's why they might put the fork in the microwave, because I learned putting a fork in a microwave is dangerous. It causes a fire, and it's going away. They might open the milk. They might even smell of it. It's curdled, and they drink it, because I had to learn that that smell and that curdle equals bad, and it's not there anymore. This is hard for us to wrap our mind around. It's really something to think on. The sense is working. The sense has changed, but it's working. But they can't make the connection. In our little graphic we have there, they're holding a banana, looking at the banana, but thinking grapes. So I'm in the right family. That can also be how it shows up. And then there's apraxia. And this is being unable to carry out routine motor tasks because they're going to lose those fine motor skills first. So tying shoes, brushing teeth, but then it goes to gross motor skills like getting in and out of the car, sitting up and down in a chair. This can really impact their balance, but we have not always been walking, and eventually they're going to stop walking. They'll develop something called the dementia shuffle, where they're not really picking up their feet. They're just kind of shuffling along. But think of what else is motor movement. It's the facial expressions. And eventually they will develop, more than likely, something called a flat affect, where it doesn't look like they're showing any emotion. But we know their amygdala is still alive, and that is our emotion center. They're still there, even if they can't show it. They're still there. Now, let's briefly touch on those 5 senses and what's changing. What controls all of the senses? Brain does. Brain controls everything. So, vision, what happens first? Early in the disease, we know it's like they go to blinders. Peripheral vision is going away. Middle stages of the disease, it's like they have on binoculars. So they are losing all of this vision around here. And late stages of the disease is like a monocle, and it's one eye. And most of the time, they won't move their neck, but they'll move their whole body. And you don't see them very often looking up. So vision's changing. Their eyes can kind of play tricks on them, where they see a rug and they try to step over it because it's a hole, or the color contrast on the floor and they think there's water on the floor. So vision is changing. Sound is changing as well. They can still hear, but they cannot filter out that background noise. So I keep a sound machine on in my office because I've got a counseling office where I'm talking with people about sensitive subjects. I've had people with dementia in my office who go, "Where is that waterfall? Where's that water coming from?" Because they're hearing a sound machine that's going, shh. That goes back to what we were just talking about, agnosia. I'm looking at the sound machine. I'm thinking it's a waterfall, where they cannot tell the difference. And even if I were to show them it's a sound machine, they're going to tell me it's a waterfall. So it's a waterfall. That thing's making noise like a waterfall, isn't it? Yes, it is. Validate their feelings. Music is part of emotional memories, and music is one of those things we use to distract a person with dementia. Smell. So those olfactory memories are very, very strong. This is why we want to use a lot of aromatherapy. Smell diminishes And they may confuse, like I gave the example of the milk, but smell remains. It changes, but it remains. So during the day, use that diffuser. I've got a diffuser here in my office. During the day, have peppermint going. Peppermint stimulates. In the evening, let's switch it over to lavender, starting to settle down. Taste is going to change and taste begins to diminish except for sweet. Because people will ask, why in the world does my loved one just want to eat sweets? Because they can taste it. That's why they want to eat it. They're losing their other taste, but sweet remains. They're also going to become less and less interested in eating because they don't need the fuel anymore. Touch, tactile stimulation. The latest stages of the disease, we call that the sensory stages because they still can feel that it's going to change. So they make fidget blankets and fidget mats. And lots of times they've got all different types of materials on them that your loved one may just want to sit and just touch and touch and touch because they can feel it. Palms of the hands, bottom of the feet can become kind of hypersensitive. We're going to talk about it more. I've got a really short video here. It's good on the sensory changes that take place with dementia.
Hello, today we're going to be taking a look at some sensory changes in dementia. When we think of dementia, we often just think of memory loss. And although this is a really big part of the disease, the damage to the brain that affects memory can also affect other things, including our senses. Now let's start by taking a look at changes to vision. To cope with poor processing capacity, the visual field narrows to reduce the amount of stimuli. This results in very limited peripheral vision. Another way the brain copes with limited processing capacity is by using monocular vision, so just using one eye. This affects depth perception, so it's not uncommon to see people with dementia failing to pick up objects or not quite reaching in the right place. Monocular vision also affects the way we process speed and movement. Even if approached at a normal pace, it can seem to a person with dementia that someone has just suddenly appeared in front of them. Another difficulty can occur over pattern recognition. Especially patterns involving lines or dots can be interpreted as moving, or interpreted wrongly, such as a circle pattern on the floor being confused for a hole. Dementia can also affect the way a person interprets sound. Damage to areas of the brain which process auditory information may limit a person's ability to understand long or fast-spoken sentences. People with dementia can also become hypersensitive to noise, meaning they can be easily startled by sudden or loud noises. They can also have difficulty filtering sound, resulting in noisy rooms becoming overwhelming. It could sound something like this.
My son would like to get dressed in a bit.
The next thing we're going to talk about is smell. People with dementia often suffer from olfactory hallucinations, smelling things which aren't there. The most commonly reported ones are burning rubber or toast. This can be distressing, giving a lack of orientation in a restricted environment. It is also common for things to start smelling different, less appealing or overwhelming, causing a change in appetite. Another thing that affects appetite is changes in taste. Loss of taste buds alters how people experience food and may result in people no longer liking the foods that they used to enjoy. Finally, it's important to think about changes in touch. Some areas of the body become hypersensitive, while other areas become hyposensitive. Typically, the mouth, palms of hands, soles of feet, and genitalia become hypersensitive, with people reporting greater tenderness in these regions. Even water from a shower can feel painful. Conversely, limbs become hyposensitive, with people reporting less sensation in these areas. This can increase the risk of injury, as people may hurt and even bruise themselves and not realise. So that was a brief overview of some of the sensory changes you can expect to see.
You may have noticed that they said that water doesn't feel good. So this leads in then to bathing and showering. They said that the palms of the hands, bottom of the feet can become hypersensitive, but that the limbs can become hyposensitive. It can honestly feel like it's ripping their skin off, a shower can, where it hurts. One thing that you can do is you can find a shower setting called Rain, And if we get those shower settings that we can adjust, and most of them do, and we put it on that very, very light rain, we're going to watch a video later that's going to help more with showering. I'm briefly going to go over some things that we can do at home. This is during those ADLs, those activities of daily living, to make sure that our loved one is staying safe at home, because again, we want to keep them home as long as possible. But we have to change the environment. Again, we accommodate the disease. They can't. Falls are going to happen. Just like they happened when we were learning to walk, they're going to happen as they start losing control of those muscles. But there are some things we can do to avoid some falls. One of the first things we can do is get rid of rugs. So you've got a spot on the floor. Who cares? I'd much rather have a spot on the floor than have them tripping over a rug. Furniture that's not being used, get it out of the rooms that they're in all the time so that they're not running into it. You just heard them talk about how that vision is coming down to that monocle and the world is just kind of pulling in for them and they will run into things. So we've got to be careful about that. Lighting is another thing. And as the day goes on, we've got to watch the lighting in the room. If it's cloudy outside, watch the lighting in the room because it can make for shadows on the floor. It can make for shadows on the wall. So be careful about that because they're going to misinterpret. And we can stand all day long and say, no, Mom, that's just a shadow. It isn't. It's a man's head because I'm seeing a man's head. So we accommodate that. Thick-soled shoes. Now, we may be thinking it's better for them to have these thick-soled shoes, but then they can't feel the floor. So you may see them taking their shoes off because it's helping them feel the floor and they're feeling a little more sturdy on bare feet or with gripper socks on. We've got to watch for the color contrast and change in floor texture. We can use color contrast all through the house, especially when we're eating. We don't want a white tablecloth, a white plate with a piece of chicken and potatoes on it because all that is here is white. So we want to make sure that we've got contrasting colors so that they're more likely to see. And then we've got lots of tips on this page. And again, you're getting copies of these because we're going to cover a lot really, really fast. So we want to get rid of as much clutter as we can. Now, they may be the clutter. They want to have the stuff around them. So we're going to clean that out a little bit at a time while they're asleep, while they are eating, while they're in the bathroom. We're going to get rid of just a little bit of stuff at a time. Make sure that we've got prescription and over-counter the medications put away. And you may be thinking, oh, my loved one's never. Well, everybody's never until they do. So be careful about having the medications out. You or I, as caregivers, I know I have to stop and think, did I take my medicine this morning? And I've got that normal 3-pound brain. Now imagine someone with dementia, they see it, they take it, and they might take their medication over and over again. Be careful also with guns and knives that are in the house. And again, you may think they've always. My loved one has always been around guns. They've always been around knives, but they haven't always had this dementia. Now, we don't know what they'll do. Let's be safe. Toothpaste, lotions, perfumes, makeup, all on the counter. Let's get rid of all of that and just put out what's needed for this task. Take it away and then put out what's needed for the next task. Is that going to be more on me? Yes, it is. But is it going to keep them independent and have dignity and longer? Yes, it will. Be very careful with those small appliances. Newer microwaves now, they have what's called a child lock on them, but we've got a microwave right here in our office where you have to put a code in to make the microwave go. The other thing you can do is just unplug it because a lot of times the person with dementia won't think to check the plug. So there's some other things on here that are important. We don't have time to go over all of them, but you're going to get a copy of this because I've got another short video I want to show you about how to make that home safe.
Well, when I moved into my new home, the one thing I hadn't appreciated was how difficult it would be to get used to being in a new home. And basically, when dementia has thrown challenges at me, I found a way to outmaneuver or found a way round so I can still live quite happily in my home. And one of the main ones when I first moved in was in my kitchen. The kitchen had 2 doors originally, and closed doors are just very confusing to people with dementia, as you don't remember what's at the other side of the door. And so having 2 doors from my kitchen, I couldn't remember where either of them led to, and I'd end up going round and round in circles. And I simply ended up removing the doors. Simple solution, but it meant I could see where each door led. Another thing was the kitchen cupboards and wardrobes. When I first moved in, my daughters asked me why I was wearing the same clothes every day. I said I didn't think we'd unpacked all the boxes with my clothes, but it turned out that I wasn't seeing the wardrobes. So my solution to that was to take a picture of the content of the wardrobes and stick it on the outside, and that attracted my attention to say, there are clothes in here. The light switches was another problem. I don't see light switches because they blend into the colour of the wall. And so a simple solution to that was simply to paint a border around each light switch. So now I can easily find the light switches. Because the one important thing to remember is that dementia isn't just about memory, and lots of our other senses are affected as well. And how we see things, our brain sometimes doesn't interpret it correctly. I used to get lost coming home. And the house that I lived in, there were 4 identical houses when I first moved in. And I'd think that my neighbour's house was my house. And I tried to let myself in my neighbour's house. But my solution to that was to put a forget-me-not tile on each side of my door. And that way I know that that door is my door. Another simple thing was for toilet doors. I forget what's behind each door, and so I simply put a T on that door, and the T just helps me to find where the toilet door is. And one of the final things I remember is in the shower, I forget how to use the shower. They rarely have on-off switches and hot cold identified, and so I simply put a sticker on each side of the shower telling me which was on and off and which was hot and cold. Simple solutions that just make living so much easier.
Now, she's very early in the disease, but you could hear she even said, wasn't that interesting? There's so much more to dementia than memory loss. She realized, I can't see the light switch. Well, then let's paint a border around it. Now, if you were to ask your loved one if that would help them, they probably would say, no. No is one of the first 5 words that we learn, and it's one of the words that will remain throughout the course of their life. But you heard it right there from someone with dementia. Now, you saw she had her iPad there where somebody had helped her put her notes together so that she could do the video, but she had all kinds of good ideas. That also explains why somebody might walk round and are opening everything, because I don't know what's in here. Taking the picture of the outside of the closet. What a great idea. Bringing that down to maybe just 10 outfits instead of 110 outfits, so that I don't have as many things to choose from. But also people with dementia will wear the same clothes over and over because I'm comfortable.
Mhm.
I like this. I'm safe in this. So buy them 3 of the same thing. Who cares if they're wearing the same outfit over and over? And if it's not soiled or dirty, let them wear it. Choose your battles. Someone sent me some things for the new year about dementia caregivers, and it said, not only do we learn not to sweat the small stuff, we learn not to sweat the medium stuff either. Not a big deal. So let's get more into activities of daily living. And I love this quote. If you're familiar with Montessori type schools, everything you do for me, you take away from me. Hear that? Everything you do for me, you take away from me. And we want to keep that independence and that dignity as long as possible. So we don't want to jump in and start doing for someone too soon or too early. We want them to be able to do for themselves as long as possible. So again, why do they get to where they can't do things? Because of the procedural memory deficits. Now, they're going to be able to read for a long time, but there's going to come a time where they can read the words, but they don't comprehend it. Remember that word we talked about earlier, that agnosia, where I can see the words, I can even say the words out loud, but I don't know what I've read. I can read Spanish all day. I don't know what I'm reading. And it's the same thing. So just because they can read does not mean they can comprehend. But while they can read and comprehend, what if we just had some written instructions down there? No, I'm not going to give an entire full page. But just like she had the picture on the outside of the closet of what was in here, she had on off in her shower. She had red and blue. We learned that when we were really young. Now, she had T on the outside of the bathroom for toilet, but I've had a lot of families go and get a bathroom like we see at a restaurant and put it on the door to the bathroom because we learned that sign as a very young child that that's the bathroom. You can even put the word bathroom, but eventually those letters aren't going to mean anything, but that symbol is going to mean something for a long time. Now, we've got here in the box, behavioral expressions commonly happen during ADL time, activities of daily living time. With dementia, these tasks that were once routine can become frustrating and agitation can quickly follow. We are just trying to help, but they are not understanding why you're trying to help. So we've got to be very, very careful with our approach and with communication. Keep in mind that 80% of those challenging expressions that we see from someone with dementia, and I'm not saying behaviors, I'm saying expressions because they're doing the best that they can. 80% of the time, those are caused by our approach or the environment. And we're not doing it on purpose, but now that you know better, you do better. Our approach or the environment, and we're going to look at our approach. Keep in mind about those 4 A's we talked about and how the 5 senses change. We have to take our time. You are never going to rush somebody with dementia. It isn't going to happen. If you hadn't figured that out yet, know it now. So we have to start getting up earlier. We have to pre-plan. If we're getting in the bathroom to start taking care of business, whether it's toileting or showering, you better have all your stuff in there right now as we get started. Let's have everything together. We do not want to have to walk off and come back. We want to encourage and reassure the entire time, be respectful and flexible. So we want to always give verbal instructions, but as the disease progresses, we're going to start using more and more visual gestures and cues and those touch cues until eventually we're not going to have very many words at all because they're not going to understand very many words at all. Those verbal cues, we're going to do one step at a time. That's all they can do. We can't even give a 2-step command in most people with dementia. So we can never say, let's say we get out to the car, we're going to the doctor. Oh, Mom, you forgot your jacket. Go back in there, get your blue jacket. It's hanging in your closet. Oh, that's a lot of information. You know what they heard? Go back in there because I'm pointing at the door. And we're in the car 5 minutes later going, where are they? We go back in and they're in the kitchen eating cookies because all they heard was go back in there, walk through the kitchen, saw the cookies, and they're done. They don't even know we're out in the car waiting on them anymore. One thought at a time. So when we're giving instructions, one at a time. And get rid of those adjectives and adverbs and just bring it down. Sit here as I'm patting the chair and I'm sitting also. Use pictures, use signs, demonstrate the activity, use those hand gestures. That's muscle memory, brushing teeth, or we're going to wash, or we're taking off our jacket. You can also use those touch cues and hand under hand, which is what we're going to look at next. Hand Under Hand is taught by Teepa Snow. And if you're familiar with Teepa Snow, there's her name, Teepa, Teepa Snow. She teaches this hand under hand process. And we're going to watch part of this video so that she gives us an example of how to help someone with ADLs.
I'm going to get on the, are you right-handed? Yes. I need to be on the dominant side of the individual because that's where they have motor memory for doing all kinds of tasks. They don't know how to use their other hand nearly as well. So what I'm going to do is I'm going to get on this side. Now, hold hands like you normally hold hands. Shake hands like you normally shake hands. Go ahead and shake somebody's hand. And realize there's nothing real comfortable about that. I mean, once you shake hands, then it's like, okay, let go. And what we can end up with is a tug of war. Or late in the disease, people with dementia often like a lot of contact, and they'll squeeze you and actually hurt you, and it's like, ow, 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 and where are you going to grab to get them loose? On the wrist, and what you're going to do is bruise them again. Shake hands, but then immediately slide up around so that what you're doing is holding on palm to palm, thumb to thumb, and you've got a lot of palm contact. Try that with your partner. And then turn it so their hand is on top of yours, and just relax the hand so that it's very clear it's relaxed. What you're doing is you're putting pressure in the palm, and pressure in a human being's palm calms them down. So what you're actually doing is helping to calm them even while we're doing things, because I'm giving them input into the sensory system. Okay? The other thing that I can do is take the other hand and lay it on top of the hand. And what I'm creating is artificial warmth and padding. What are they missing? Warmth and padding. So all of a sudden we're feeling more comfortable. Now there's a big difference between me being down here where she can see me, because remember the visual field problems? What happens if I'm up here?
Like no, I just see the...
Yeah, and what if I face her like this? What she's going to start to do is mess with me here, or she doesn't realize what I'm doing, and it feels to her like I'm bossing her around. So I want to either sit down or get down so I'm at her level and she can really look at me. The other thing I can do, by applying just a little bit of pressure, she'll automatically look, and now I can talk to her. I'm going to help you get washed up. Okay? Good. Listen, let's take your shirt off. There you go. Now, that's a little less distressing because she understood what I was doing by being to the side and having a single person in the room. And I'm not being loud, I'm not being noisy. What else do you think we need to think about doing in the room, given that she doesn't have any insulation and I'm about to have her come out of her shirt? Get it really warm. Who's going to need to be sweating? Me. I need to be hot so that when she comes out of her shirt, she's not uncomfortable. Because if she is uncomfortable, is she going to want to take more clothing off? No, because she's cold. Here's the next thing we're going to do. I'm going to take a warm towel fresh out of the dryer and drape it around her shoulders. Now, when I do that, what happens to her exposure in the front? She's covered, she's modest, but what can also happen, she's warmer. Then what I can do is wet her through the towel. I don't even need to take the bra or the underthings off yet. I let her keep some modesty, because once you get your clothing wet, what do you think most people want to do?
Take it off.
Take it off. And if I haven't had a battle up to now it makes sense to take those off. Okay? Here's the other place I want to put a towel. Across the lap. Why? That's the other modest place, and that's another place that's real sensitive.
Some things that we probably don't even stop to think about. Of course, you can have a towel on while you're in the shower. Am I going to have more laundry to do? Yes. Am I getting them in the shower? Yes. She mentioned taking things right out of the dryer, but you can also buy towel warmers. That's what I've got. I've got a towel warmer. So that towel warmer's in there. Got heat lights that we put into the bathroom because they stay cold. And if they stay cold, I'm not going to want to take my clothes off. And this water doesn't feel good. So you heard Tipa say, I'm the one that's going to be uncomfortable. I'm the one that's going to be sweating, but we're going to get in here and get the shower done. And a huge part of it is, again, our approach and the environment. Have some music going. That's one of our tricks, is that we put some music on so that it's not about the shower. It's about these songs we're singing. And we can get in and out of that shower in about 3 Beatles songs because we're getting in there and we're sitting about the shower. It's about, I know this one. Do you know this one? And here we go. And we're busy. Now, some other things I want us to think about as we go into grooming. Are you doing what you want, or are you doing what you know will be helpful? We've got to move over and do what's going to be helpful. With grooming, if you look good, you feel good. So we're going to encourage our loved ones to wear makeup, to keep their beard trimmed, to get those regular haircuts, to go to the beauty parlor and the barber shop, and to have the pedicures and the manicures just to keep our nails trimmed and clean. We might have a spa time or a spa day. And what's fun, I know at our day program that we do photo shoots, and we'll call them glamorous grandma and dapper dads. And we thought, oh, the men aren't going to go. The men loved the pampering, I think, more than the women did, because we had a bunch of women who was pampering them, I think was part of it, who came in and did nails and really got their fingernails cleaned up and their toenails cleaned up. That oral care, we can start to use assistive or adaptive devices. And you can actually type in dementia adaptive devices or dementia assistive devices. You can go on Amazon. You can go on a website called SSWW. It's called SNS Worldwide. You can go on a website called ALZ Store, ALZ Store, and find all kinds of adaptive or assistive devices to help with grooming, feeding, bathing, and toileting. Some of them, I'm going to show you some more pictures, but here's some of them right here. Also, they make these long-handled toothbrushes. The handles are a little bit different. The handles are a little bit heavier, so they're easier to hold. And let me show you, let's go to dressing. Let them pick their clothes out. Let them pick their clothes out as long as possible. Now, again, just opening a closet door, that is overwhelming. But if I hold up red or blue, you look really good in the blue, and then they say blue, then they just chose their clothes. We can lay their clothes out in order. We can hand them their clothes in order. Be careful about busy patterns and stripes and circles. You heard in the one video how stripes and circles can move with the way their eyes are changing. There's also adaptive clothing, and a website for adaptive clothing is called Buck and Buck, B-U-C-K, Buck and Buck. And it's where it looks like regular clothing, and it looks like it's got a zipper, it looks like it's got a button, but it's not. It's Velcro and it's elastic. Buck and Buck. You can also find some on Amazon. Slip-on shoes, and there's lots of slip-on shoes right now. And those cardigans instead of those pullover sweaters, because remember, they're going to be cold all the time. We're going to layer their clothing. If they're fidgeting with some of their clothing, with those buttons and zippers, again, just switch out the clothing. Let me get over here to eating, because there's some things that we can do to allow them to continue to feed themselves as long as possible. Don't rush them. You can use swivel spoons. That's an interesting thing, especially if they've got a tremor, if they've got Parkinson's. There's a spoon that swivels so that they can get it all the way up here to their mouth and it won't spill. We can use, if they're starting to lose weight, which they will start to lose weight, because what metabolizes the food? You might be thinking this is, but what tells that to do it? The brain is. So we're going to add things to their food. We can put protein powder in. We can make smoothies with Carnation Instant Breakfast plus some protein powder. We can always add ice cream to those smoothies, and we can put in some fruit, and we can add some yogurt. There's all kinds of things we can do. Now, I want to show you some pictures here. Look at that plate guard that's down there at the bottom. With that plate guard, And that weighted spoon, you can actually push the food up against the plate guard to get it up onto the spoon. And then you'll see this mug with two handles. Now, I've heard people call it an adult sippy cup, but that sounds like something for a child. So we're going to call it a mug with two handles. It is an adult sippy cup, but dignity, just like adults don't wear diapers, adults wear briefs, adults don't wear bibs, adults wear clothing protectors. This is all about independence and dignity. So that mug there with the two handles, again, Amazon, ssww.org, and all store. Let me show you over here with the bathing. Helping them bathe can be very frightening for them. Water doesn't feel the same. You saw that we just watched the Teepa Snow video on bathing. We don't always need that full bath or that full shower. We may just need a sponge bath where we're doing face and hands and feet and underarms and their private areas. So be careful about our bathing techniques. We're not going to force someone unless they are soiled, and we're still not going to force anything. Use those warm towels, allow them to keep the towels on them, and have that safe, calm atmosphere. That amygdala is still intact, which means not only can they show their emotions, they can read your emotions. So if you're getting worked up, if you've got a furrowed brow, if you've got a scowl, they are picking up on it. But if I've got the music going, I had to learn to do this a long time ago. I've got that music going and I'm bebopping around and I'm loving these warm towels. They can feed off of us. Always have everything ready ahead of time. Tell them what you're doing step by step. Be flexible. And if they don't want to bathe, let's do it later. And then it might be we need a different type of bath, because we may need a bed bath if they're bedridden. We may just need a basin or a sink bath if they're in a wheelchair. We might be able to do that tub bath or the shower or the shampooing. But again, there's different types. They also make the full-sized washcloths that are disposable that you can put in the microwave. I've seen them at Walmart. I've seen them at Walgreens. I've seen them at CVS. And then they're disposable. Now, let's look at toileting real quick. We were not born already potty trained. And I said we're going back in time. And they're going to think about the steps in potty training where we're going to do that backwards. So becoming incontinent of bladder first and going through lots of where maybe they've got their hands in their pants or they're holding themselves because they've got the urge to go, but they got to go right now. Think about when we were potty training those babies and how they would do that, or they're looking around or they're hopping around a pee-pee dance. We may start seeing that. We need those easy on, easy off clothes. We've got to label that bathroom. You heard the woman say she used a T. I like the idea of the full bathroom sign like we see at a restaurant. Keeping a bathroom schedule where we're going to go every couple of hours. And if I go up and say to someone, do you want to go to the bathroom? No. Anytime we ask them a yes or no, we're probably going to get no. But especially for ladies, let's go. We love to go together. We're just going to go to the bathroom together. We're going to run in here at the bathroom to see if we need to go. Now look at this picture of the toilet seat that's a different color, because think about what that toilet seat looks like. It's white on white. So we can get these toilet seats that have a different color on it as well. If you can't find a toilet seat that's a different color, they even make lights so that there is a light that makes the bowl of the toilet a different light. Urinary tract infections are really common for people with dementia. First of all, they tend to get dehydrated. Why do they get dehydrated? One thing, they're not drinking as much. So we can use those, I was just talking about them this morning. One of the name brands is Liquid IV, but they're a hydration multiplier. There it is, hydration multiplier. They sell them everywhere. They're in every grocery store. They're in all the pharmacies, hydration multipliers. And you mix it with a bottle of water, and it makes 1 bottle of water be the equivalent of 3 bottles of water. Liquid IV is one name brand, but Walmart has its own brand. Kroger has its own brand. They're all doing the same thing. And they have a taste, and they also make sugar-free. So it's kind of like drinking a Kool-Aid or a Crystal Light. Hygiene is not the same as it used to be, as you know. And so they may get urinary tract infections because of hygiene. And then I was at a conference a couple of years ago and listened to a urologist talk about this. They get to where, because of their dementia, their bladder doesn't fully empty. So there's always that little bit of urine in there, and they'll start to grow bacteria. So we can do everything that we possibly can do to keep them from developing a UTI, a urinary tract infection, and they may still develop one. We can try the antibiotics, but what tells that antibiotic to work? And eventually the antibiotics don't work. That's one of the top 3 ways a person with dementia passes away, is becoming septic from something like a urinary tract infection. We can put them in the hospital and have IV antibiotics, but if the part of the brain that tells that antibiotic to work isn't there anymore, isn't functioning anymore, doesn't matter. We can't make it work. So we're going to keep them as comfortable as we possibly can. So we can help with the hydration as much as we can. We can help with the hygiene as much as we can. And we can help with emptying that bladder as much as possible. So some of the things we just talked about were those 4 A's and the 5 senses. We talked about some home safety and those activities of daily living. My information's on this last slide, and you are going to get a copy of these slides. You can contact me at any time. There's my phone number and my email. So let me stop sharing and we will do questions. Let me check the chat. Let's see. How frequently do they need to bathe? That is person by person. They don't need to bathe. Over the age of 65, I think the last one I saw was like 2 times a week, as long as you are as long as they're not soiled. So, because you don't have the same oil production that you used to have. So again, that one's kind of play it by ear, but we're not going to force somebody to go into a bath just because it's bath day. Choose your battles kind of thing. Different sensation when they walk barefooted in grass. Absolutely. Because the bottom of the feet, that video was talking about the bottom of the feet becoming hypersensitive. Yes, UTIs are frequent in men also. They're frequent in both. And in men, especially more so from the dehydration, but it can also be from the hygiene. So, but it's also because they're not emptying their bladder as well. Other questions you can type in the chat. With 38 people, you can probably unmute and ask your question.
Just unmute yourself, and if you are on a telephone, I can actually see that you have unmuted and call upon you. And it's amazing that you got all this into this short period of time, Holly.
Woo! I'm taking a breath.
You always do the best job trying to get everything out there.
I keep watching the time, and then I watch the time, and it shows me my number of slides I'm on, so I know when I need to pick it up speed a little bit.
Well, we may get more chats or questions, and I will pass them on to you.
Sure.
But I would like to say that, you always do such a state-of-the-art, brilliant talk on these things. And we've had other talks on this topic. And this one it's so practical, and it so hones in on what our big problems are. Let's see, Heather, maybe we could point out that women have frequent UTIs because they forget to wipe from front to back.
Right. Caregivers may need to be told as well. Exactly right.
Yeah. Thank you for that. Thank you all for being with us, for all of your input, for what you do every day. It's so amazing. It's just amazing.
And a lot of times they'll forget to wipe it all, and then they have very moist underwear or briefs. And so that's another reason to be checking to make sure that they're not wet. We can then develop skin breakdown, where again, someone can become septic because of skin breakdown. Now, we may be thinking, well, why in the world is their skin breakdown? Because they do not have the reserves that you or I have. And so skin breakdown is really, really common. Skin tears are common, especially on the arms and legs. You heard the video talk about that they can become hyposensitive on arms and legs. And I was walking with a woman one time. Her arm was going along the handrail and it was peeling back the skin. She wasn't even feeling it. We were leaving a trail of blood behind us, but she wasn't feeling it right here on her arm. So they may not even feel that they are wet or that they are moist in that area. So just making sure that they're dry. There's also, I would never say to put on an adult, we're not going to put diaper cream, but we call it a moisture barrier. So there's always another word for things so that we're not, that's degrading. I don't want anyone standing over me telling me to put on a bib because I might give you a fist and I've got a 3-pound brain. So imagine someone with a 2-pound brain or a 1-pound brain, and we're calling it a diaper or a bib, or we're talking about them like they're a child. And then we wonder why they had a aggressive, challenging expression.
Right. Something really important I want to tell you folks before we go is that if you're not registered, if you got this the Zoom link or the telephone number from someone else, please call our customer service representative at 866-390-6491. It's 866-390-6491. Once you get registered, you will not only get these resources, these slides from here, but what you will also get is a monthly calendar so that you can see all of the stuff that's coming up. So with that, I just want to thank you all so much for your participation today. I want to thank Hollie, who's a mastermind at putting these together and getting the most recent stuff for us and what doctors are saying and everything. So thank you so much, Hollie, once again. And I'd also like to thank the WellMed Charitable Foundation for finding people like Hollie and talking her into doing it multiple times. And because she's so good at what she does, and she does it every day. So she knows so well what she's talking about. And with that, I am going to go ahead and stop the recording. And
All
you're
right.
getting lots of love from the people who are on today, Hollie, and you deserve it.
You.
So I want to
Thanks,
thank you so
everybody.
much. And let me see. I'm going to stop the recording.